Eating disorders are serious mental health disorders with life-threatening physical and psychological complications. The effects of malnutrition, and other results of behaviors associated with eating disorders, can lead to serious organ damage and sudden death. In addition, half of all deaths related to eating disorders are from suicide. If you have an eating disorder, it's important to recognize the seriousness of your condition. You should seek professional help, preferably from someone who is an expert in helping people with eating disorders. More people die from eating disorders than from any other category of psychiatric conditions. Types of eating disorders. Eating disorders are disturbances in your relationship with food that are severe enough to cause problems with your health or your social relationships. Some common eating disorders include anorexia nervosa. This condition is characterized by severe restriction of food, even if you're dangerously underweight. If you have anorexia nervosa, you may deny that a problem exists, even if people tell you how underweight you are. You may tie your self-worth to being thin and be terrified of gaining weight. Many people with anorexia nervosa have a distorted body image. They believe they're fat even though they're underweight. The median age of onset for anorexia nervosa is 18, and it's more common in girls and women than in boys and men. Bulimia nervosa. This eating disorder is characterized by episodes of binging, eating a lot in a short amount of time, and then practicing some kind of behavior to compensate for the binge, like vomiting or using laxatives. During a binge episode, you may feel unable to stop eating or control what you're eating. People with bulimia nervosa may try to compensate for the binge behavior by vomiting, abusing laxatives, diuretics, or enemas, fasting, or exercising excessively. The median age of onset for bulimia nervosa is 18 years old, and it's also more common in females than in males. Binge eating disorder. This disorder is similar to bulimia in that large amounts of food are eaten at once, but not purging, making yourself vomit, or abusing laxatives, diuretic drugs, or enemas, or performing any other compensating behavior. If you have binge eating disorder, you may be overweight or obese. You may be at a higher risk for diabetes, high cholesterol, and high blood pressure. Binges are more likely if you're depressed, having trouble coping with difficult emotions, or depriving yourself of food, such as by dieting. People with binge eating disorder were often overweight before their eating disorder began. People with binge eating disorder are more prone than the general population to feel disconnected from their communities. In the United States, 2% of the population has binge eating disorder, and it's slightly more common in women than in men. Avoidant, restrictive food intake disorder. This disorder involves food avoidance based on a lack of interest in food or the sensory characteristics of food, or a negative experience with food, such as choking. Avoidant, restrictive food intake disorder is more common in males than is anorexia nervosa or bulimia nervosa. This disorder often begins in infancy or early childhood and can persist into adulthood. Pica. This disorder involves eating non-food substances such as chalk, dirt, or yarn. Rumination disorder. This condition involves repeated intentional regurgitation of food that is then rechewed, reswallowed, or spit out. Other specified feeding or eating disorder. This diagnosis may be given to people with symptoms of an eating disorder that causes distress or impairs social functioning but doesn't fit the specific diagnostic criteria for any of the disorders listed above. Causes of eating disorders. A combination of biological, psychological, and environmental factors appears to contribute to eating disorders. These include genetics. Inherited genes appear to play some role, with anorexia and bulimia present in more sets of identical twins than fraternal twins. Family distress. Family characteristics that may raise the risk of eating disorders include poor communication, high perceived parental expectations for achievement or appearance, marital tension, difficulty managing conflict, and devaluing the maternal role. Sexual abuse. People with a history of sexual abuse are more likely to develop eating disorders. History of dieting. 1/3 of normal dieters progress to pathological eating habits, and 20 to 25% of pathological dieters progress to having an eating disorder. Preoccupation with a thin body or social pressure about weight. These factors are particularly relevant when a person's self-esteem is tied to weight and perceived attractiveness. Athletic and artistic endeavors that emphasize leanness. These activities may include ballet, gymnastics, figure skating, running, and wrestling. Eating disorders statistics. According to the National Eating Disorders Association, NEDA, 20 million women and 10 million men currently living in the United States will suffer from an eating disorder at some point in their lives. In the United States, the prevalence of most eating disorders is similar among non-Hispanic whites, blacks, Hispanics, and Asians, but anorexia nervosa is more common in non-Hispanic whites. The incidence of anorexia in young women ages 15 to 19 has increased each decade since 1930, Netta notes. Furthermore,